Hello everyone, welcome to Physiotherapy in Lesotho, www.physioinlesotho.ch. You are listening to a podcast from one of our physio workshop in Lesotho. Your speaker is Thuso, W. Fasser, a qualified physiotherapist.
Now we're coming to the physio dimension of treatment of neuropathy. This is our profession. Physiotherapy helps to ease the pain and the nasty sensation. Because most of these people, they are complaining of nasty sensation. They have pins and needles, they have burning, they have sharp pains, they have numbness, maybe they have feeling a sensation from being cold or hot, all these nasty symptoms. We try to relieve the nasty symptoms, pain and other symptoms. Happy. Physiotherapy helps to relax the muscles because so many of these patients, they are complaining of cramps. At night, legs are cramping. Physiotherapy helps to activate the muscles. We relax them and then we activate them so that the movements are more harmonious. Sometimes they say, I cannot move my toes, I don't feel them, or my foot is not responding. So we help them with exercise so that we make these nerves more lively. We stimulate them. So we help to ease off the nasty symptoms, we help to relax the muscles, and we will activate proper movements. Physiotherapy helps to improve balance, because if you have these feet, these polyneuropathy feet, that means you are not feeling properly with your feet, somehow your balance is disturbed. They say, I feel not safe on my feet. I have the impression I can fall. Or when there is darkness, I don't see properly. I'm really afraid that I will fall. So they have a balance problem due to this neuropathy because they don't feel the floor. So physio helps to improve balance skills. And then physio helps to improve the circulation. When the circulation is disturbed by neuropathy, we will help to improve that circulation. So if that finger is so cold, we'll do everything that that finger gets warm again. Or if the hand is hot, and even reddish hot, we will help that this heat is easing off. You can have both circulatory problems. You can have too cold, it's more common, but it can be too hot as well. So we will harmonize circulation. This is the task of physio in these cases. And then there is another task. Sometimes these nerves, the peripheral nerve, maybe has the neuropathic change, but maybe is as well somehow troubled by soft tissue. Maybe that nerve is adherent, is attached to another tissue. Maybe that nerve is under compression from a swelling. Or just simple, mainly up here on the shoulder we can see that, or in the buttock. The muscles are too short. Patient is not doing regular stretching of that area. So the muscles are too short. Soft tissue is too short. So that nerve is somehow not moving properly. And already this can create peripheral neuropathy. We have many of these patients with pins and needles in the arm, and the problem is tightness of shoulder girdle. And then there is a syndrome resulting, we are calling thoracic outlet syndrome. So the nerves up here in the shoulder they are pinched, they are squeezed, they are pulled, they are somehow under pressure. And then in the periphery, the nerve gives us the symptoms. Problem is up here on the shoulder. So we will do massage, we will mobilize the soft tissue, we will stretch the soft tissue, we will do exercise to loosen this tissue so the nerve will be mobile again, will move freely, and then the symptoms, they go away. So this, we call it nerve entrapment. Or there is somehow a dysfunction of the mobility of the nerve. Comes due to shortening of tissue or swelling. So physiotherapy improves as well the biomechanics of the nerve. We said before, we improve the nausea symptoms, we will improve the relaxation of the muscle, the function of the muscle, the circulatory problems, we will improve them, and we will improve the biomechanic of the nerve. Sometimes these neuropathy symptoms, they are worse because the nerve is somewhere attached, somewhere pinched, somewhere entrapped, we called. So we massage and we stretch, we mobilize all along the nerve. We take that nerve and we work on it to make it more free. However, remember, even a nerve has an internal metabolism. In these nerve fibers, there is a metabolism going on. And the nerve metabolism is improved by using the nerve. When I challenge the nerve, that means I make use of movements, I stimulate with various type of stimulation, I challenge that leg to be circulated, that there is necessity of blood flow. When I stimulate the nerve will improve in its metabolism. When we are passive, when we are not moving, because people say, oh, my foot is somehow, I better don't move it. When we are passive, the nerve metabolism is not stimulated. That means neuropathy can go on. But if we stimulate the nerve, if we improve the nerve, the internal metabolism of the nerve, neuropathy can be stopped and influenced, sometimes even inversed. So we need to stimulate that nerve. Another effect of physiotherapy is when you do movement and you do massage and you do the self-treatment, you give a lot of stimulation to this nerve. And when the extremities are stimulated, it will block pain. It's a mechanism. We stimulate to block pain. If I'm not stimulating the nerve, pain will be more. So therefore we have to stimulate. The concept is we stimulate that nerve. We're training the movements, we're reducing the sensory symptoms, and we're improving a proper circulation. We're working on the balance and we stimulate, and then we ease off the biomechanic of the nerve. So we have to make that nerve moving freely. Is that understandable? This is the concept. Therefore, we have to work with these pains. Normally, neuropathy is chronic. These people sometimes for months can have problem. So therefore, as soon you start to see it, start treatment. It's easier to treat in the beginning. It's difficult to treat when it is already a long time. Now please discuss with your neighbor. What do you think is the most important thing in the treatment of neuropathy? Please discuss that. What do you think is the most important thing in treatment of neuropathy?